Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We're glad to have you all here with us this morning. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs. I'm going to be your host and one of the presenters for today. And presenting with me is Jeanette Ringo, who is one of our community outreach specialists in Mississippi. And today, for the August installment of Webinar Wednesdays with SMP, you're going to learn about pharmacy and prescription drug fraud. During the presentation, you're welcome to type in any questions that you might have into the chat, but we're going to hold those until the end of the presentation when we open it up for Q&A. And if you registered to attend this webinar prior to 10:15 a.m. this morning, your name has been entered into a drawing on a prize wheel. So we will be giving away a $25 Amazon e-gift card later. You do have to be present to win. Before we get started, we do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of the funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects of the federal, like we said, the U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Before I turn things over to Jeanette, I just wanted to do a quick poll. Our polling question for today is, do you have a prescription drug coverage as part of your Medicare plan? So the answer is yes or no. Do you have a prescription drug coverage as part of your Medicare plan? And I'll give everyone just a few seconds to put their responses in. All right, I'm going to go ahead and close that poll and share the results. And what we're looking at, I guess 75-ish% said yes, you do, and 24% said no. All right, so I'm going to, let's see if we can hide that. And now I'm going to turn things over to Jeanette, who will get us started on prescription drug fraud and scams.
Good morning. I'm Jeanette, a community outreach specialist in Mississippi. So today for the August installment of Webinar Wednesday with SMP, we're going to learn about pharmacy and prescription drug fraud. Medicare prescription drug coverage, also known as Part D, is the part of Medicare that covers most outpatient prescription drugs. If you have a Medicare Advantage plan, your benefits could include prescription drug coverage as a part of your plan. Medicare Part D is a separate insurance plan that is offered through private insurance companies for those enrolled in original Medicare, Parts A and B. The availability varies by state. These plans cover prescription medications for outpatient services. Most prescription drug plans charge a monthly fee that differs from plan to plan and you pay this fee in addition to your premium, your Part B premium. Next slide, please. Pharmacy and prescription drug fraud is a consistent trend in Medicare. Criminals ranging from healthcare providers to drug trafficking organizations continue to commit prescription drug fraud because it is profitable. Unfortunately, there is a strong illegal market for prescription drugs, including controlled substances such as opioids and expensive medications. Next slide, please. Now, we're going to take a look at some of the types of pharmacy and prescription drug fraud and scams. A pharmacy intentionally provides you with less medication than you were prescribed. A pharmacy may issue you expired medications. Also, you are provided with and billed for an expensive compounded medication, including topical pain creams, when a traditional or less expensive prescription was ordered by your physician. Next slide, please. Here are a few more types of prescription and pharmacy drug fraud types. A company offers you free or discount prescription drugs without a treating physician's order and then bills Medicare. A pharmacy may automatically refill a prescription you no longer need. You do not pick up the prescription, but the pharmacy still bills Medicare. An individual offers to pay for the use of your Medicare number to bill for prescription drugs or offer you cash or other compensations to pick up prescriptions on your behalf. Next slide, please. Medicare identity theft could be another component to pharmacy and prescription drug fraud. You should always be wary of if someone requests your Medicare number and other personal information to evaluate your prescription history at health fairs, senior centers, assisted living facilities, malls, markets, farmer markets, home shows, parking lots outside of retail stores, or a privately sponsored wellness event. Medicare identity theft occurs when someone steals or uses your Medicare number to submit fraudulent claims to Medicare without your authorization. Medical identity theft can disrupt your medical care, and it could result in financial harm. Next slide, please. You might be wondering how to spot pharmacy and or prescription drug fraud. These are two ways you can do that. Be sure your doctor has assessed your condition before prescribing you any medication. Do not give out your Medicare number or other personal information to unknown individuals requesting it for prescription drug services. Next slide, please. I want you to be on the lookout for these things. Review your Medicare summary notice, or the MSN as it is known, or the explanation of benefits, called the EOB also. Charges for the following: prescription drugs, including refills that were never picked up, delivered, or even prescribed. Prescription drugs, occasionally controlled substances such as opioids that were prescribed by a healthcare provider you have never seen. Amounts beyond the quantity you were prescribed. A different prescription drug, often a more expensive drug than the one you were originally prescribed, or a drug that is not approved by the the U.S. Food and Drug Administration, the FDA. Sorry about that. Next slide, please. Now we will turn things over to Sunny, who will review the SMP 3 keys to success: prevent, detect, and report.
Thank you, Jeanette.
Thank you.
So the first key is prevent. Protecting your personal information is going to be your best defense against healthcare fraud and abuse. You should only share your Medicare number when it's necessary. when you're going to the doctor, or when you're going to the pharmacy to pick up your medications. Only carry your Medicare card when you know that you're going to need to use it. You want to remember that Medicare will not call you to ask you for your Medicare number for any reason. One of the most common reports we get to our toll-free hotline number is from beneficiaries who are receiving calls from someone who claims to be from Medicare. They might identify themselves as Medicare, or they might say they're with Medicare. One the other day was they were with the Medicare Providers Network. And what they're calling about is they're asking about, did you receive your new card? And sometimes they'll say you're supposed to receive a new plastic card, or Medicare is putting chips in their cards. Have you gotten your new card? And then oftentimes, after the beneficiary reveals their information to the caller, they continue on the line and they start asking about durable medical equipment. And so it turns into an offer of, we're going to send you some knee braces or a back brace. And so then it goes from just taking your Medicare number to now durable medical equipment fraud and scams. So it's really important to remember that Medicare does not make phone calls. They're never going to call and ask you to verify your information for any reason. You also want to help prevent Medicare fraud, you want to keep records of all of your medical visits and procedures that take place. So write these things on a calendar. Write the date that you went to the physician. Make a note of what took place that day. And that way, when your statements come in, that kind of leads us to our next piece of detect. So knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. So it's really important to pay attention to those Medicare summary notices, which are often called MSNs, or explanation of benefits, which are often called EOBs. You want to make sure that you pay attention to those and make sure that the charges belong to you. So your Medicare summary notice is mailed to you by Medicare every 3 months. If you're on a Medicare Advantage plan, you're going to receive an explanation of benefits from them after you receive healthcare services. And you want to compare your statements to your personal records. So this is where that calendar comes in. You've got your calendar that shows when you went to the doctor and what you had done. You want to compare that to your Medicare statement. You want to check for medical appointments you didn't attend, or maybe something that was double billed. Look for medical equipment like braces, diabetic supplies, or even urinary catheters, which is something that's real big right now. Anything on there that looks suspicious that you did not order or you never received. Those are the things that you want to look out for. And then, of course, the final key is report. So if you see something that looks suspicious or you suspect that you've been the target of fraud, you want to report it. This will help you and others at risk for healthcare scams. Now, some of the steps to report suspicious behavior, you could, if you received a suspicious phone call, you want to make sure you don't give out any personal information and report the call to SMP immediately. If you have questions about your Medicare statements, oftentimes you can start with your healthcare provider. Give them a call and question them about the dates and the charges that you see. You can even call your plan and ask them. But if for some reason something happens and you're not comfortable calling your provider, or you're not really satisfied with the response you got when you did call them, you can always call us at our toll-free hotline number that's shown on your screen, and we'll look into it. Now, you might be wondering how you can help and become involved in the SMP program. We're always looking for individuals to join in our fight against Medicare fraud and scams. SMP volunteers receive training on the basics of Medicare and healthcare fraud, errors, and abuse. In addition to giving presentations, kind of like what we're doing today, and attending community events, our volunteers participate in bi-monthly webinars, and they're offered various training opportunities throughout the year. And we also host volunteer appreciation events in the month of April to help celebrate National Volunteer Week. Volunteering for our program is extremely flexible, and it's done on an as-needed basis. Our volunteers really determine how often they'd like to participate and how busy they would like to be. If you think that volunteering is something you might be interested in, you can go ahead and give us a call. Our toll-free hotline number, again, 877-272-8720. You can talk to me about it and we can send you an information packet and answer any questions that you might have about the process. So you can follow us on Facebook and other social media platforms if you want to stay up to date on the latest scams that are impacting older adults in your community. You can scan the QR code on your screen using your cell phone's camera, and that'll take you to a guide where you'll have access to all of our Facebook pages, our YouTube channel, our podcast, Sip and Learn with SMP on Spotify and Apple. Our state-specific SMP Facebook pages are really a great resource for you guys, for older adults and their care partners, to find out about the hot scams that are happening as soon as we learn about them from reports called into us or from our community partners. All of that information is shared across all of our social media platforms. So as we mentioned on the previous slide, we do have a toll-free hotline number that you can call to report potential healthcare fraud and to ask us questions or even request that we attend your event or speak to a group that you might be a part of with our fraud prevention message. We cannot be successful in fighting Medicare fraud without reports from people like yourself and invites that allow us to reach older and disabled adults in your community. Additionally, you can visit our website, stopmedicarefraud.org, for more information about the SMP program in your state. Our website can be viewed in multiple languages by adjusting the language tab at the top right portion of the screen. And we'd like you to stay tuned for our Webinar Wednesdays topic for the month of September. On September 25th, we'll be talking about home health hospice, home health and hospice fraud and scams. Just be on the lookout for an invitation for you to be able to register for our next webinar soon. All right, so now it is time for our prize drawing. Everyone who was registered to attend today's webinar, you had to register before 10:15 this morning. Your name has been entered into a prize wheel. And if you'll give me 1 second, I'll pull that prize wheel up. There we go. And you do have to be present to win. We did have a lot of folks register for today's webinar, so there's a lot of names on here, but hopefully we'll only have to spin once or twice to get our winner. So we're going to go ahead and give that wheel a spin. All right, it looks like Miss Peggy Bowles, you're our winner today. And I see that you are here with us, so great. So I'll be reaching out to you a little bit later today to make sure you get your $25 Amazon e-gift card. And let's see if we can get back over to our slides. There we go. All right, so now before we wrap up our presentation today, I do want to open it up to Q&A. So if you have a question, if you look on your screen, there's a way for you to raise your hand and we can unmute your line and you can ask, or I'll check our chat questions real quick to see if we had any. But if you do have something, just go ahead and raise your hand and we'll get to you. Let's see. All right, well, oh, is there a hand? There was a hand raised briefly. Okay, well, I'm not seeing any hands raised. This will conclude our presentation today on pharmacy and prescription drug fraud and scams. You will be receiving an email from us later today with a link to a short survey. We would really appreciate it if you would take a moment to visit that survey. And it just lets the Administration for Community Living know how we did with today's presentation. I'll also send a thank you email. So if you think of a question, you'll have our contact information and you can always reach back out to us. So we appreciate you joining again this morning for Webinar Wednesdays with SMP, and we hope to see you all again soon.